Welcome to the St. Louis County PDMP Dashboard and Patient Search tutorial. This demo is for those users providing patient care. Upon account approval, you can now log in and utilize the PDMP. User account approval will begin on April 4th, 2017, and the PDMP will be fully operational on April 25th, 2017. Before April 25th, users will be able to review their user profile and dashboard. This review of the dashboard and patient search functionality is using a demo site. No protected health information is contained within this site. All information has been created for educational purposes. This tutorial will demonstrate the dashboard, patient search, and user profile functionality for a physician. First, you must log into the PDMP. Upon logging in, you will be directed to your dashboard. As a healthcare provider, you will see patient alerts, if you have any, recent requests, which are the recent patient searches performed by either you or your delegates, and a list of all of your delegates, if applicable. To the right, there will be a PDMP announcements and quick links section. Quick links are links to substance abuse resources, including the DPH, PDMP website, treatment locations, CDC prescribing guidelines, and more. The Announcements tab at the top will display the same announcements as on the right side of the screen. To perform a patient search, click the RX search at the top of the screen and then select Patient Request. To complete a patient search, you must provide, at a minimum, the patient's first name, last name, and date of birth. Additional patient information can also be provided. You can also select the time frame of prescription information to examine. The PDMP will default to search the previous 12 months, but you can shorten or extend that time frame to up to 24 months. To the right is PMPI Internet Connect search. PMPI Interconnect is the interstate data exchange which can also be utilized when performing a patient search. You can set your default search states in your user profile and add or remove states as needed for each individual search. Upon submitting a patient search, if there is only one patient identified, the patient report will be displayed on the screen. If multiple possible patients are identified, additional patient information can be used to select your patient. Now, let's interpret the patient report in front of you. At the top, you will see the patient's name. If you select the patient's name, you can expand the patient information box. This box will show the patient's address and linked records if there are any. Next, you will see the suspected prescriber or pharmacy shopper alert, which is generated automatically when a patient obtains controlled substance prescriptions written by 3 or more prescribers and filled at 3 or more pharmacies within a 6-month period. This alert does not confirm that a patient is engaging in any illegal or risky behavior, but is to be interpreted as an educational and possible intervention point for providers. The summary line totals the number of prescriptions, providers, pharmacies, private pay prescriptions, and active daily morphine milligram equivalents, or MMEs. The active daily MME field sums up the total current MMEs that the patient has an active prescription for. In this example, the patient has received a total of 27 prescriptions in the past 12 months, 19 of which were filled in the last 6 months, but none of them are current or active opioid prescriptions, which is why the active daily MME is 0. The prescriptions box contains more detailed information on each prescription, including bill date, date written, drug name, prescription quantity, days supply, prescriber, prescription number, pharmacy, number of refills, MMEs per day, payment type, and the state PDMP that the records are from. The MME per day differs from the active daily MME in the above summary line, as the MMEs per day is specific to each individual prescription. The active daily MMEs total the MME per day across all current opioid prescriptions. Below the prescriptions box, you will see additional information about prescribers and dispensers that your patients may have seen in the past. Scrolling down, we will now take a look at the prescribers box. Available in the prescribers box are the name, address, and locations of all prescribers, and in the dispensers box are the pharmacy names, locations, and phone number and contact information for all dispensers. Moving back up to the top of the dashboard, you will find additional information available to physicians. Also under the RX search header are requests history and patient alerts. Clicking now on requests history, we will display the previous searches performed by both you and your delegates. This screen provides an expanded search history and request activity from the dashboard. Here you can see who requested the records and who they were requested for and on what date they were requested. Moving to the Patient Alerts tab, you will see the alerts for patients that you have prescribed controlled substances to and the alert letter that was generated for all of the patient's providers. This screen is also an expanded history from what is displayed on the dashboard. Moving back up, on the top of the screen in the blue line, next to RX Search, you will see User Profile. Under the My Profile header, you can view and edit your profile. This is the screen where you can select your address and change your email and submit confirmation. Moving across the user profile screen, you will also see additional options. The first tab, Default PMPI States, allows you to set the states you want to automatically search using PMP Interconnect, the Interstate Data Exchange. When performing patient searches, you can also modify the PMPI Interconnect search states for each individual query. It is recommended that you only search the applicable states, and not all states unless necessary. Additional state searches will slow your result time. Next, you can click on Delegate Management. This screen allows you to approve or reject delegate users under your account. And then Password Reset allows you to reset your password. Your password must be reset every 90 days. You will receive email prompts when your password is nearing expiration. At the top of the screen, next to the User Profile tab, you will also see a Help button. If you select the Help page, it contains frequently asked questions on how to use the PDMP system. If you have any problems with the PDMP, please contact the APRIS or AWARE technical support line at 1-844-947-8526 or St. Louis County at 314-615-0522.